Welcome to the Virginia Hospital and Healthcare Association's Patients Come First podcast. We're thrilled to have Dr. Kurt Newman, the President and CEO of Children's National Health System in Washington, D.C., join us today on the Patients Come First podcast. Thanks for being with us, Dr. Newman.
It's a real pleasure to be here.
Well, we're glad to have you. In a moment, we're going to talk in some depth about Dr. Newman's forthcoming book, which is named Healing Children, and about Children's National, which is one of the preeminent children's hospitals in the nation. But before that, Dr. Newman, if you would, could you please just tell our listeners a little bit about yourself, where you're from, your family, educational background, personal interests, things like that?
Sure, Julian. I grew up in North Carolina, in Raleigh, North Carolina. Went to college at the University of North Carolina in Chapel Hill, and then went to Duke University Medical School. So I learned early on to bridge conflict between the Tar Heels and the Blue Devils. And while I was at Duke, I got very interested in surgery, and I'll come back to that, but decided to go into surgery as a career, and trained in general surgery at the Brigham and Women's Hospital in Boston. And it was in Boston that I discovered pediatric surgery when I rotated through the Boston Children's Hospital and really fell in love with that specialty. And that was sort of started on the road to come down to Washington, D.C., and that was in 1984 to do a 2-year fellowship in pediatric surgery at the Children's Hospital. There was a great surgeon there who was the chief, and his name was Judson Randolph, and there was an incredible faculty, and it was a wonderful hospital. And I just fell in love with it, and here I am almost 32 years later. Most of my career at Children's National was as a pediatric surgeon, so a practicing pediatric surgeon. But then 5 years ago, I had the opportunity to become the president and CEO and lead this great children's hospital.
Well, I'm interested by the Tobacco Road rivalry that you mentioned. Where do you fall on that divide? I imagine that the rivalry has intensified over the years, but that divide between Duke and UNC is certainly one to be bridged, as you said.
Well, I pull for each of them when they're not playing each other. I have trouble when they play each other, but I usually pretty easily come down the side of the light blue color. I think you always go with your undergraduate, though it is UNC Chapel Hill at the end of the day. But I love Duke, and particularly the medical school.
So let's shift here and talk about your book, which again, as we noted, is called Healing Children, A Surgeon's Stories from the Frontiers of Pediatric Medicine. This is a memoir that focuses on how patients, families, and colleagues have shaped the way you think about care and medicine, and it highlights the importance of pediatric medicine. As you've mentioned, you've had a pretty long and varied career in which you've worked with many families and patients. I wonder what inspired you at this stage of your career to put pen to paper, so to speak, and how long has this book been in the works?
Well, I have been inspired by so many children and family over the years. But what I wanted to do with the book was to empower parents to learn and know some of the things I've learned over the 30 years I've been in pediatric medicine. Because I believe that everyone wants the best for their children. But most people don't really know the priceless value of doctors and hospitals that are focused exclusively on children. So I wanted to share my insights on that to help them, to activate them, to be advocates for their children's health with the knowledge that I might be able to give them from my experience on the front lines of being a pediatric surgeon and now a CEO of a great children's hospital.
You mentioned parents being advocates, and that's incredibly important. As we think about healthcare, and you also mentioned how important healthcare providers and hospitals and health systems are, and one of the things, regrettably, that we've seen sort of in recent years is how much healthcare has sort of turned into a political football. But to your point, it's really always important to bear in mind that healthcare ultimately is about helping people. And along those lines, you sort of pose a fundamental question in your book about who is speaking for the children. And I sort of wonder, as a pediatric surgeon for the past 30 years and as a leader at one of the nation's top children's hospitals, what are your thoughts about what the future of children's health care should look like?
Well, my experience in thinking about what children's health care ought to look like, what the hospitals and the physician relationships should be, was shaped by my own experience in the beginning of being a patient in my own medical school at Duke, where I discovered that I had a lump in my neck, which turned out to be a thyroid mass and turned out to be a thyroid cancer. So you can imagine the perspective of being a medical student, yet at the same time being a patient. And I vividly remember my surgeon at one point in the whole discussion, because I was, really worried, and the words cancer was not something I'd ever really thought about myself. And he opened his shirt and showed me his scar, and it incredibly had the same thing that I had. And he'd had surgery himself, and it was a thyroid cancer. And he kind of showed me, in a way, through his story, that it was okay and things were going to be okay. And that has just stuck with me through my years as being a surgeon, of, in a way, embracing the family and bringing them into it. And I talk about in the book about the importance of mothers. Obviously fathers are important, but one of the things I've learned over the years is how the mother's instinct and trusting that instinct is so helpful to parents themselves, and they should trust those instincts, but also to the team that's caring for them, to bring them into the conversation when you're making rounds, involve families, involve the parents in the children's care. And we've tried to create that philosophy at Children's National, and I think it's probably true in most children's hospitals, that you want the parents on the team. You want them to be advocates, and you get the best outcomes when that's the case. Another perspective that has shaped my thinking is just taking the long view, which is so important with children. So it's not just what is happening right now and how we're going to solve that problem right now, which is so easy to do particularly in surgery. You're presented with a problem, you figure it out, and you then create the solution. But to think about the future of that child, so the development. And I remember, and I tell a little story in the book about, and this goes back to my own situation with that surgeon and the scar, was thinking about a young girl who had cancer, and I was going to have to do a procedure. And I really thought about thinking ahead of what she was going to look like in her prom dress or her bikini, and making sure that the scar accommodated that. Now, that was an interesting discussion with her mother, but it meant so much to that girl, and I saw her not too long ago, and we had a great time laughing about that, but it was so important to her that scar be in the right place. And that's the kind of thing, we want to be always conscious of. How is that child going to develop? What does the future look like? There are so many dimensions to the thinking around pediatrics and what we can do in pediatrics, and there's so much research and innovation coming with genetics and early diagnosis and the ability to correct things, that it's a very, very exciting frontier. It all goes back, though, to thinking about the child differently and thinking about the different biology they have, the different resilience that they have, and how they can bounce back from things, to think about their development and how the brain develops. A concussion in an 8-year-old is so different than a concussion in a 12-year-old or an 18-year-old, because the brain is developing. So I also talk a fair amount about finding doctors and hospitals, emergency departments that are aware of those things, that have those specialists that are knowledgeable about brain development or bone development, that can really bring that expertise into the whole idea of that children's medicine is different, and children's hospitals are different, and for people that want the best for their children need to advocate for that and find that and be part of it for their own children.
And even though, as you point out, there are differences between pediatric medicine and what people would sort of think of as general or acute medicine care for adults, the universal theme that I hear expressed in what you just said is that it's patient-centric. So that story you shared about working with the young woman and her mother so that the scar would leave a minimal impact and would be minimally visible, those are the kinds of things that really illustrate the patient-centric care that occurs at hospitals and health systems throughout the Commonwealth. So that's a great story, and appreciate you sharing that with us. Another story that you and I have discussed briefly, and I'd like you to share it if you would, and also remind me on the particulars of it. I think you keep either, I forget if it's on your desk or on your person, an image of, is it a child's heart? If you would, remind me of that story and share with our listeners that keepsake or that memento and what it represents.
Well, I always want to be thoughtful and reminded of just how different children's medicine is, and one of the most graphic ways I can do that is I have a 3D printed model of an infant's heart. It's no bigger than a walnut, fits in my pocket, and I sometimes bring that out to not only remind me, but to when I'm in conversations, just to make the point, and it makes it very graphically for folks of how different the anatomy, the biology is of a baby, or maybe a fetus, or maybe a teenager. And at pediatrics, we have to be thinking about that whole spectrum, because in heart surgery, for example, it's not a big organ. It's smaller than a walnut. I think the other neat thing for me and how I use that printed heart is to remind folks about the innovation that's coming, the ability to, with research, that it's not far off, that we'll be creating organs that can be transplanted in. We're already doing that with cells and with transplants, but that we'll be able to do just some incredible things. And a lot of the conditions that currently now we struggle with, maybe it's cancer or, who knows what, genetic diseases, we're going to be able to correct. And the other perspective from the pediatric point of view is that there are a lot of adult conditions that we can detect early and make interventions early and maybe prevent the long-term consequences. Maybe it's heart disease, or maybe diabetes, or maybe it's some of the mental health issues that we see. So, I just make the point over and over again, and sometimes I feel like a preacher about this, but that the resilience, the biology of children, and then you tie that to the technology and the breakthroughs that are coming. There's just so much hope and optimism, I think, for the future of medicine and pediatrics. What I do worry about is, are we investing enough? And I listen to the debates on Capitol Hill, and I hear a lot of the discussion and the controversy. But what I don't hear a lot of is conversation about children and about the impact of some of the proposals on children and children's health. And I hear about Medicaid cuts, and 30 million children are covered by Medicaid in this country. Yet we're talking about cutting a program that is so essential to children. So what I worry about, and what I think we ought to be doing, is not cutting, but making more investment, because of the great potential to improve health, detect things early, avoid problems down the line, which in effect will save a lot of dollars, but most importantly, our kids will get what they need and be solid students. They'll be great citizens and go on to do great things.
Well, to your point about preaching, I think most people would agree that a little bit of proselytizing on behalf of healthcare and public health, on behalf of fellow citizens, is not a bad thing. On a final note, I'd like to point out that in addition to being a good read, Dr. Newman's book will also benefit healthcare, as a portion of the proceeds will be donated to the Pediatric Health Opportunity Fund, which is a charity providing support for research and innovation in pediatric medicine. So that's a very good thing. I wonder, Dr. Newman, if you would just tell folks, if they're interested, where they can obtain a copy of your book, Healing Children.
Well, thank you, Julian, and it's been terrific to have this opportunity to talk about my book. There's a part of the book too that I wanted to mention, which is tips to empower parents to learn about the resources. There's so many great hospitals and health systems in Virginia. And I think one of the key things is for parents to think about their child and potential emergencies ahead of time, to plot out what emergency department they want to have their children go to that has the special capabilities for children, whether it's the equipment, whether it's the specialists, that they're geared for children. That's the kind of thing you want to know ahead of time before you get into the middle of it. When there's so much going on, it's hard to make a decision. So the whole goal of that part of the book is to empower parents to ask the right questions, to be part of the team, to get prepared. As far as buying the book, obviously there are a lot of ways you can do that, whether it's on Amazon.com or Barnes & Noble. All of the websites now have that, or go to your local bookstore. Or if you want to come up here to Children's National, I'll be happy to sign it. And, I'm really looking forward to sparking a conversation with people about how to access the best care, what's best for their children. But it's through these great stories about children and their families that I think will inspire a lot of the people listening.
The book is Healing Children, A Surgeon's Stories from the Frontiers of Pediatric Medicine by Dr. Kurt Newman, who is the president and CEO of Children's National Health System in Washington, D.C. Dr. Newman, thank you for being with us today.
Thank you so much.
During this segment of the podcast, we like to share with our audience a healthcare story that we've either seen on TV or read in a newspaper or online, something that we found interesting and think that if you have a few moments to look up, it would be worth your while and something you might find interesting as well, particularly if you are interested in healthcare. So Erin is going to join us and share one such story. Erin?
Thanks, Julian. It's officially summer, and high school and college graduations have come and gone, but nurses at a North Carolina hospital are ensuring babies leave the neonatal intensive care unit are getting their moment. The staff at Birthplace, a birthing and family care center at Caramont Regional Medical Center in Gastonia, North Carolina, have been holding mini ceremonies for babies leaving the NICU who were born 6 or more weeks premature. Each NICU grad gets sent home with full honors and receives a personalized graduation cap made of foam sheets and a portrait. Neonatal nurse Melissa Jordan started the program about 6 months ago when a baby who had been with her for 62 days was finally leaving the NICU. Since the program began, 14 babies have graduated from the NICU, including 3 sets of twins. The work happening at Caramont Health is one example of the kind of great work happening in community hospitals in Virginia and elsewhere. To read this story and see great photos of the graduates, search online for NICU graduation.
That's going to do it for today's episode of the Patients Come First podcast. You can find new episodes as they become available at www.vhha.com. You can also find episodes of the podcast on SoundCloud and on other popular podcast portals. We also encourage you to engage with us on social media, including Facebook and Twitter. If you'd like to send us comments, questions, or feedback for the podcast, you can do that through our Twitter account at VirginiaHHA, using the hashtag PatientsComeFirst. Thanks.